All right, good morning and happy Thursday, everybody. Thanks for joining us this morning. For those of you who don't know me, my name is Matt Schmidgall. I'm the school programs manager here at the Pima County Health Department. I'll be leading our call today. As always, these meetings are recorded and we'll be sending out the link to watch it for any of your colleagues that aren't able to make it this morning. Our agenda today have a few announcements. We're going to kind of recap our guidance and recommendations that we as a health department have kind of aligned ourselves with on according to the CDC and ADHS. We'll go ahead and give our local COVID data update, and then we'll close out with a few resources. And then as always, if you have any questions, feel free to enter those into the chat as we go along, or once we get to the end of the meeting, any questions that haven't been answered, we'll have an opportunity for you to unmute and ask those questions. Really, only one announcement this week, but it is a pretty significant announcement. We received some feedback and looked at a survey that we had asked everyone to participate in last spring, or this past spring rather, asking the best time for these meetings. It sounds like moving them up a little bit earlier in the day would work better for most folks. And so beginning next Thursday, these meetings will move to 9 o'clock. So we will be sending out new calendar invites to everybody who's on our current invite list. So if you have forwarded this to your colleagues, the meeting invite, make sure that they get included in the new invite. And if you're one of those folks joining us today that received this meeting from one of your colleagues, let one of us know here at the health department. We can make sure that you get on our contact list and receive all the updates directly from us. All righty. So let's get into our COVID update. So our county did move into the medium level. Last week we were at the low green level. We did move into medium, and so that is a yellow level for our county. Although we're at a medium community level, we still remain at a high level for a rate of transmission. So we're currently at about 215 per 100,000 in the county. That's up almost 20% from a week ago. This data does get refreshed on Thursdays. And so this is as of last Thursday. We checked the CDC website even 10 minutes ago, and it hadn't updated yet today. And so we're curious what those numbers are going to be like today when they come out. Wouldn't be surprised if our county does creep up into the high red level. The rest of Arizona is currently at that red level as well. In terms of vaccines, we've started to kind of take closer notice of those who are remaining or continuing to be up to date on their vaccinations. So as a reminder, up to date means that they have not only received their primary series, but they've received any boosters that they're currently eligible for. So we're looking at about half of our population, 5 and older, are up to date on their vaccinations and have received their eligible boosters. We're hovering around 80% of our population that has received their primary doses. So we can see that there's some hesitancy there in receiving those boosters. So of course, we're still encouraging everybody to get their booster shots if they're eligible. This is what the page looks like on the CDC website. We encourage everybody to just bookmark this page. The links are included in this presentation, so when it goes out, but this really is where to find all the information and kind of scroll through it yourself and stay up to date on where we are with numbers. This kind of leads us into our guidance and recommendations specifically for schools. We know that everybody, if you haven't started school already, you're getting very close. And so the health department is looking for ways on how we can support schools. And we've heard that some specific guidance and recommendations would be helpful. So we have aligned ourselves to the CDC, but thought it might also be helpful to kind of compare our situation as it was coming into last school year versus this school year, because they are different. So not to re-traumatize anybody, but if you remember a year ago, we were still in a state of emergency here in Arizona. And through that state of emergency, local health departments were given authority to kind of enforce our mitigation and reporting protocols. And so the county health department did that through a sanitary measure. There were multiple versions of a sanitary measure that got released as the circumstances changed. But essentially, the sanitary measure required that students and staff who tested positive for COVID, they had to isolate, right? And those that were considered close contacts, they had to quarantine. And as a health department, we were able to support schools by enforcing that through legal orders as necessary. It didn't happen very often, but if a family refused to isolate or quarantine, we were able to step in with some legal authority. As the school year went on, things changed. Some of the reporting changed. We started letting schools know that they only needed to report outbreaks. Earlier on, the health department was providing templates for close contacts and outbreak letters to go out to families that were kind of official, unofficial county letterhead and signed by our health director. We're also providing test kits to schools and providing PPE, so sanitation, supplies, masks, things like that out to schools. So this school year, we're no longer in a state of emergency. And so with that, we lost our authority to no longer be able to legally require really anything. And so there are no more sanitary measures. I don't expect that there will be any more sanitary measures pertaining to COVID. And so what this means is that as a health department, we continue to share out recommendations and guidance. We can no longer legally enforce that guidance. And so what does this mean for schools and how we support schools in the upcoming school year? We're going to do our best to continue updating schools and sharing out information as it gets updated through the CDC or ADHS. And then we're also looking for new ways to assist in reporting, because we also understand that schools are bound by FERPA, and that has limited their ability to report cases to us. So some of the changes we're looking at include a new reporting form that will hopefully be released. We're expecting sometime next week, hopefully, fingers crossed. And this will allow schools the ability to report case counts. And so that will essentially mean anytime there's a positive case at a school, it's just letting us know, hey, we had a positive case, or hey, we had 2 cases today. And not necessarily requiring all of the details such as names and birth dates and things like that. However, if a school is operating under a CLIA waiver and is testing students, and those students are testing positive, those are required to be reported, because you're operating under a CLIA waiver, you're acting as the laboratory, and as that provider, you are required to test those positive results. If you're not operating under a CLIA waiver and these are just home tests being sent home with students, or perhaps a family called you and told you that their student tested positive, we'd still like to know that there was a positive case that popped up at your school, but you don't need to provide that personal information to us. When it comes to your own policies, one thing that the county can provide is that we are, while we are encouraging school districts to draft their own policies and protocols, we are happy to have one of our epidemiologists review those policies. They can look at your documents, they can meet with your team. And a couple districts have already taken us up on this offer. If your district hasn't yet and you would like to take advantage of that service, please reach out to us and we would be happy to work with you on that. The county also is continuing to provide test kits to schools, so it's the same request form as before. We checked this morning and we are well stocked with test kits. It might be a different name that you're not familiar with. I'm trying to remember. FlexFlow or something like that is the new test that we have. We have plenty, so we're encouraging schools to go ahead and request those test kits as they were before. And then our PPE supplies are also well stocked. So we have masks in all sizes, including adult, youth, and children's size masks, sanitation supplies such as bleach, and then other PPE supplies, booties, coveralls, face shields, all kinds of stuff in our warehouse that we're happy to share out. So some of the guidance that we're going to be looking at does kind of correlate to our community levels. And so that's why I wanted to just put in this slide and remind everybody. I think everyone's familiar. There are three levels: low, medium, high, stoplight system, green, yellow, red. And so here's kind of just a broad overview, and nothing really should be new or a surprise. So first and foremost is encouraging everyone to stay up to date on their vaccinations. Staying home when sick. So kind of, if someone is showing symptoms and they're sick, they should just stay home. Even if it's not COVID and they're at risk of spreading, an illness to somebody else, they should stay home, right? We knew this before COVID. Optimizing ventilation and improving indoor air quality. If your school isn't sure how to do this, the CDC and the EPA have some great resources for that. Going back to hygiene, so hand washing, so encouraging schools to really kind of just remind and teach their students on proper hand hygiene and hand washing. Cleaning and disinfecting, masking, which we'll talk about in a minute, and then screening testing, which we'll also touch upon in a little bit more detail. So masking. So when it comes to masking, really, we're encouraging masking at any community level. Really what this comes down to is schools really just providing a safe setting for any student who feels that they should mask, having some sort of flexible, non-punitive policy in place that would support those individuals who are choosing to mask. Once we get to a high community level, it really is strongly, strongly recommended that we adopt universal indoor masking, especially in schools and other congregate settings. So that's really what it is when it comes to masking. We're not sure with school starting next week if we'll still be in yellow. If we're in red, just something to keep in mind. We'd be highly recommending that we start the school off with masks if that's the case. Screening testing really is just setting up some protocol for testing folks who might be suspected of exposures, even if they're not showing symptoms. So screening testing could take place at the beginning of school, when students come back from a break, maybe a sports team was out at an event and they're returning, so times like that. When we get to medium and high, we're really encouraging schools to implement screening testing and think about those high-risk activities such as indoor sports and other extracurricular activities as well. Another one that wasn't on the first list, but we wanted to add in here is cohorting. So this was a concept that some schools adopted earlier on, so kind of creating pods and classrooms. So still a great mitigation strategy to kind of break students up into cohorts and keep them in small groups and staying together to try and minimize contact between other groups of students. And so this can become more effective, as community levels go up into the red. So another thing to keep in mind. We know there's also confusion around how to calculate quarantine, right? So the good news is this hasn't really changed. The bad news is it's still kind of tricky to figure out because there's a lot of different scenarios. The CDC does have a calculator that makes it really easy to kind of punch in any various circumstances, and it'll help calculate. But essentially, we'll go over it real quick. If someone is exposed to COVID-19, so they're a close contact, and they're not up to date, meaning they haven't received any eligible boosters that they would qualify for, they should quarantine, which means stay at home for at least 5 full days. And then during that time, they should be wearing a mask. And if after 5 full days they're able to, they should test. If they're symptom-free and they test negative, they can come back and remain wearing a mask for another 5 days. So that's if they're not up to date on their COVID-19 vaccines. If they are up to date, they do not need to quarantine. They should still get tested after 5 days, and they should continue to wear a mask around others for 10 days. And then the last kind of scenario we're looking at is if someone is considered a close contact and they had confirmed COVID in the last 3 months, the last 90 days. It looks similar to if they were up to date, with the exception that they were recommending that they do not test after 5 days. So they may not need to quarantine. They should wear a mask. They should monitor for symptoms, but we're not recommending that they test after 5 days. And then, of course, isolation, it's the same as before. If somebody does test positive for COVID, they need to isolate for at least 5 days. And then if no more symptoms, then they can return with a mask for 5 more days. I think this was talked about last week, and we just added the slide in here again, but we want to make it clear that we are moving to this term of up to date. And so fully vaccinated and up to date mean 2 different things. Fully vaccinated means someone has received their primary doses. Up to date means they've received their eligible boosters. So most of the recommendations you see are using this up to date language, meaning that we expect people to have received their boosters if they're eligible for them. All right, that was about it for guidance. Our resource slide is still in here, so some helpful links for you all that you're welcome to take a look at. Our team can be reached, as always, at schoolsupport@pima.gov. You can also call our school hotline, 724-7018. Currently, our team has gone through a little bit of transition. We're planning next week to kind of introduce everybody. But Erica Spence, who helped with the testing, she's no longer with the department. Connie Johnson, who is our public health nurse here on the team, she's also no longer with the department. And so currently we have a great team of Sylvia Vasquez, Candy Pipes, and then myself and Kat Davis are your team. And we're happy to help in any way we can. So that ends my part of the presentation. I'll be honest, I have not looked at the chat this whole time. So I'll take questions. I see one hand up. Go ahead and ask your question. Or if anybody else would like to unmute and ask a question. Well, let me go ahead and work my way up from the questions in the chat. So where can we schedule a vaccine clinic at our school? You cannot find the link on the website. We'll go ahead and make sure that that gets sent out, and maybe one of my colleagues can put the link in the chat. I just want to plug, since you brought up the website, that we are revamping the webpage specifically for schools to try and make it a little bit more easier to navigate and find the information you need. So we're working really hard on that, hoping to get something to go out next week. And of course, we'll share that with you when it becomes available. And then I saw a question in here about hard copies of recommendations. We're also working on drafting up just a document to send out for schools that says here's our stance on COVID recommendations, what we recommend schools do, just so you have something in writing. It's not going to be intended as anything really to go out to families. We're aligning ourselves with what the CDC and ADHS is recommending, but we will work on something to give out to everybody. see. Any other questions? If your hand is raised, go ahead and just unmute and ask.
That's another question.
Oh,
Matt,
yes.
sorry, about under what circumstances we would close a classroom for an outbreak. And
yeah, that's a good question. Oh, did you want to answer it, Kat?
I was going to say, yeah, I would just say we won't be doing that. That goes along with the emergency, the other changes. We won't be closing classrooms under our own authority. If a school thinks that they might need to close a classroom, they can still chat with our EPI team and get some kind of guidance and recommendations. But this would be a school district or board decision to do that.
Thanks, Kat.
Yep.
Matt, this is Mariana. The EPI, and I can add to what Kat said. Most of the time at this moment, it will depend on how the school sees, as Kat says, your situation, and if you can relocate or kids, or if you don't have enough staff. But it's going to be we could give the recommendation, but the decision is going to be yours.
Yes, thank you, Mariana. And if schools are planning, or districts rather, planning on drafting some sort of protocol or policy, again, if they would like our team to take a look at it, our team last year did draft up some considerations for classroom closures. And so, you know, we're happy to talk with schools about it. But ultimately, yes, the decision will fall on school administrators. Great questions. Anybody else?
Hi, Matt. I have a quick question.
Hi.
Hi there. Is there any requirement for early childhood programs to post notifications of a COVID positive case that was in the classroom?
I believe there is. Actually, Sylvia, you're here. Sylvia is our expert on early childhood education. I'll let her take it.
It depends on your licensing authority, what they ask you to do. There's a you can call them up if you're licensed from the state, and they will be able to tell you. They cover that. And I've been told from other places that they post something. So I would say yes, but you need to contact them.
Thank you.
All right. Well, we know we're getting down to the wire, and so questions might arise. If you all need support at all in this next week as school is starting up, please reach out to us. If there's a specific way you think the health department can be of support, let me know and we'll see what we can do. But in the meantime, be on the lookout for a new calendar invite. And if you haven't started school yet, we wish you the best of luck as we welcome students back for the school year. So, take care, everybody. Thank you.